At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Fibromyalgia on Wednesday, June 12th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Welcome to Dr. Tom Roselle Live. Hey, everybody. Hope you had a great couple days. And by the way, it was really wonderful meeting so many of you the other night at the office. It was really fun. I enjoyed it. Kind of opened the door for you, hopefully, on the subtle indicators of cardiovascular disease and the things that you need to be looking for. And not only that, but proactively what you can do about it. It was always a pleasure, sharing the platform with Dr. Stephanie Pina. She's amazing. A woman really knows her stuff when it comes to naturopathic medicine. And we were able to turn on the lights, I hope, for many of you to show you that, you can't ignore certain things, because if you ignore the signs and symptoms, and some of them aren't, feeling badly necessarily, but you got to look at your face, you got to look at your ears, you got to look at your hands, you look at the, what your tongue looks like and so forth. And they're indicators that you have to do something now. You can't wait. As I think I told everybody the other night that, the guy that just, has never had any symptoms or suddenly drops dead was considered a healthy person. Not necessarily so, but the cure, the fix, is not all of the medications, the aspirins and the statins and things of that nature. That's not where you start. Those things don't prevent heart attacks, even though that you're led to think that they do. But we walked you through the pathways and we showed you all the tests that should be done and the things that you really need to consider. If you really become proactive in your own health, you become your own captain of your ship, if you will. Remember, health is a do-it-yourself program. Then you can begin to take a position where you ask better questions, if you will. And if you ask better questions, then you can really add to the platform. So many of us, we get to a place in our life that, we don't want to be bothered. Could I use that phrase? There's a lot of contradictory stuff. But if you go back to basics meaning what's going on with you neurologically, what's going on with you biochemically, in today's world, bioelectrically, and how does your mind work in the decision-making processes? What do you accept as true for yourself? And at the end of the day, if you really do a self-analysis and you know that you're really not putting the right things in your body to support your system, you're clogging up that fuel tank called your heart, your arteries, your lymphatic system, and so forth, that you go into stinking thinking, everything is negative and nothing's positive about the world, it's going to have an impact. It'll affect all of you. Now, the thing that we're going to start touching upon, and we talked about it the other night, is chronic pain patterns. On June 12th, at the Roselle Center for Healing in Fairfax, we're going to do a night on chronic pain and fibromyalgia. You've heard that term across the board. They like to advertise it on television because they want to sell you a lot of drugs, and most of these are psychogenic, believe it or not. They dumb down the neural receptors in the head. They really don't do anything about much, except that they want to dumb down the pain, thinking that if they break the pain cycle, that perhaps maybe that you will, get better because of that. Well, in 47 years of experience in clinical practice and a very significant paper that I wrote many years ago called Fibromyalgia, the Undisease, and what that really means and what I was talking about is that, and even today, fibromyalgia is diagnosed by ruling everything else out by traditional allopathic physicians. So if you're in pain and they can't find a reason for it, then they coin it fibromyalgia, which is an unfortunate situation because this can be diagnosed properly. And on the 12th, I'm going to show you what the diagnostic criteria is. We'll talk about a couple of them today, but as we get into it over a period of time, you'll understand a little bit more about that. You can hurt all the time, but it may not be a fibromyalgic pattern. You can have pain that is debilitating, but it may not be fibromyalgia. There's a very specific set of criteria that you have to look at. And, when they tell you that there's no chemical diagnostic platforms, they're telling you that they're just lazy. They don't want to go after it because most insurance companies don't want to pay for it anyway. And some of them is invasive, but they put the physiological platform together and really understand what it is that produces this ugliness, this pain, this debilitating process, then they might be able to treat it, but they don't understand the physiology behind it. Again, my opinion based on everything that I've run into after all these years. So what I want you to know is that if you understand something physiologically and you embrace it properly, then you have a shot at fixing certain things. Now, here's the deal. Think about this. If you look up fibromyalgia, if you go to Dr. Google and you go to some and the other search engines, they're going to come up with, it's this, it's that. They're going to talk about the emotional status. They're going to talk about, certain types of pain patterns. I read something this morning in preparation, to talk to all of you. And this one author said that the characteristic of fibromyalgia is that if you press on a joint space, the pain gets worse. Well, let me tell you something. There's a lot of things that will produce that same indicator. This author was saying, well, most pain patterns, if you press on a joint, they don't produce an increased exacerbation of the pain. Well, really? Tell that to an athlete that just twisted his knee or his shoulder or his ankle or wrist or anything else. And if you go in and press on that, I promise you, it's not going to feel good. And so that diagnostic criteria has to go out the door. It doesn't mean anything. Now, coupled with some other things done properly, there's a little bit of relevance there, but you have to really understand what that really means. And I will get into that with you as we go through. But here's the piece. I've treated chronic pain patterns in all types of patients from every walk of life that you can think of. I've had the privilege of treating professional athletes back in the day. Can I say the term? The Washington Redskins. I know it's blasphemous. I'm not supposed to say things like that anymore. But from 1985 to about 1995, I had the privilege of treating a lot of these very intense, high-level athletes. And trust me, they were in pain. And my job was to make sure that they were able to function that following Sunday, so they could go out and do it again. And then off season, maybe we have a shot of really resolving things and putting it back together so they didn't have to go through the slings and arrows of surgery and things of that nature. Now, you couple that with other intense athletes and people who are driving. But where a lot of the pain patterns come from? It's not from impact injuries. It's from bodies doing nothing. You say, what? I mean, sitting around doing nothing. Postural positions that stress the body out, and we don't do anything to compensate it, like sitting on our keyboards and our cell phones and our head down and, in awful positions when we're sleeping, and it goes on. And we ignore those little things because we start dumbing it down with all kinds of anti-inflammatories or analgesics, or, we call them NSAIDs and acetaminophen and things of that nature. Now, what does that do? It doesn't do anything except continue to perpetuate the underlying problem because we're ignoring what the triggering mechanisms might be. So we're going to talk about not only fibromyalgia, but chronic pain syndromes. We're going to talk about myofascial pain syndromes. We're going to distinguish those things for you over a period of time, and we're going to put it together. So if you know anybody that's in pain, make sure they listen to Dr. Tom Roselle live or go to the live stream broadcast immediately after this show today, because we're going to start focusing on some of the things that you need to know about to be able to put your life back into a very strong, productive, unpainful existence. Wouldn't that be great? I think so. But when you go to a doc and you complain of neck and shoulder soreness and they say that you have fibromyalgia, I would take another hard look at maybe it's in an incorrect diagnosis. But so let's start with basics, okay? Let's talk about basic pain patterns and what fibromyalgia might be and maybe what it isn't. Then we'll kind of add on to this over the next few weeks so you really get exactly what the deal is when it comes to this. Interesting articles that were published, and it's kind of been left alone now because of the world of COVID. But guess what's happened? COVID also has triggered the return of a lot of chronic pain patterns that just don't seem to want to go. But the truth is that fibromyalgia is present as a true condition in up to about 8% of the population. And the characteristics are that it's widespread. It's not just your neck, your shoulder, and your right arm. It's not your low back and your hip and down in your toes. You can have all kinds of pain that makes that very disturbing and making your life very difficult, but it's not fibromyalgia. So when the incidence is up to over 8% of the population of this country, and it's characterized by incredible pain and often very significant fatigue, ultimately it's going to affect a lot of other things, like what? Your sleep. It's going to affect your memory, because pain has a way of doing that. It dumbs down the neurological pathway. But what we're talking about is pain that is debilitating, that doesn't go away, and we have to really understand what it was. Now, the other night at the office, when we were talking about a very interesting presentation relative to your heart and your blood pressure and so forth, we started talking about pain as well. And we talked about these things called catecholamines. And we said that they live in the adrenal center called the medulla, that little adrenal gland that sits on top of your kidneys and keeps you alive, basically, as your fight-flight pattern. And so when that is disturbed, because it's dependent on something called serotonin and tyrosine and 5-HTP, which is the next step after tryptophan. Now, tryptophan is that, when you eat too much turkey at Thanksgiving time, that's what puts you to sleep. That's a down regulator, but it also is the initiator of other different pathways within the system. So we have to understand that fibromyalgia is one of other centralized pain patterns. That means that it's from the central nervous system, brain, spinal cord, and then extends into the other areas of your body. But let's break down the terms first so you understand what we're talking about. The term fibromyalgia simply means this. Fibro means fibrous connective tissue. We're not talking about a joint. We're not talking about bone. We're talking about tissue. And it can be tissue that wraps and envelops tendons and ligaments and the wrappers around the bones and so forth. But it is not the bone. It is not the joint space. And when we talk about other centralized pain patterns, we're talking about, these other chronic, long-term pain presentations. And we'll get into that. For right now, we want to be very general in what we talk about. And some of them, present with all kinds of symptom characteristics. And they're due to something happening in that central system, that brain, that spinal cord, and it amplifies itself throughout the body and all these things that we talk about. Do you think if you're in pain all the time that your mood's going to change, that it might cause some of the neurochemicals that make you happy and keep you calm? If we look at neurotransmitters, we're going to look at things like serotonin. We're going to look at things like, GABA. We're going to look at things that are down regulators and just kind of make you relax and go to sleep at nighttime. Our friend melatonin. And we begin to look at the wrong places in understanding of what it really is. But when we look at this condition, these chronic patterns, there's so much disconnect in the traditional community. You look at one article and it's going to say, well, only about 4% of the population. Now you look at another article and it goes up to about 10% of the population. But that's just for really true diagnostic criteria of fibromyalgia. And it's known as the fibromyalgia complex, if you will, in many of the searches that you're going to go look for. And it requires a look to really understand it in a multidimensional pattern. The traditional treatment today in the allopathic is using what's called tricyclic antidepressants. And these are serotonin and norepinephrine inhibitors, right? They stop the cascade as far as supposedly it reduces the pain pattern by 30% or more. That's not a lot. If you got a pain threshold of 1,000 and you're only dropping it down up to, and it says up to that level, it tells you that they're missing the target. They're not understanding it. So the paper that I wrote years ago, Fibromyalgia, the Undisease, I brought out some very specific characteristics. And I said that the fibromyalgia diagnosis has to be complete with the measurement of cortisol, urinary cortisol. It has to be measured with serotonin as well. And there's ways of doing that, particularly in today's world, but we're not doing that. Now, there's another piece that in a chronic pain pattern, in a fibromyalgic specifically, if they did a biopsy of the muscle, the wrap around it, the fibromyalgic pattern presentation, that it looks like a piece of frayed cloth. Like when you pull something way too tight and you get all these fibers that are broken, it increases in size and it looks like it's frayed under microscope. But they don't do that, even with people who are suffering dramatically. If they knew that's what it was, the next step is, now, what might cause that to occur? And there are very specific things that would cause that to show up that way. But the primary diagnosis is this. Fibromyalgia, according to, and this goes back, way back, to the American College of Rheumatology. These are the guys that are supposedly setting the criteria that everybody, seems to forget. And they said that it has to have 11 out of 18 known trigger points in the body. And that's inside the knees, at the low back, at the neck, behind the upper portion of the neck, near the shoulder presentations and so forth. They have to have 11 of them. And it's a very specific mapping pattern. Now, if you have 7 or 8, you're in pain, you're hurt, but it's not fibromyalgia. And the fibromyalgia pain has to be present for a minimum of 4 months without going away, and it has to be full body pain. Again, as I said earlier in the program, it can't be neck and shoulder or low back and leg or one part of the area. It has to be all 4 quadrants. So that means if you take from your neck down, you have to have everything hurting all at one time. Now, we're not talking about how heavy the pain is, but it's there and it's all 4 areas. Now, if you have pain in one area, you got pain, you're hurting bad, but it doesn't mean that it meets the criteria of this craziness of this fibromyalgic pattern. So please understand that. That's the first thing. The second is the length of time that it's been there. Then we get into the other pieces of the puzzle. There's been some success, again, in these drugs, these tricyclics that we talked about, and they're using other things. They're using things like dopamine agonists, and so they want to shut it down. They've been using opioids, and dopamine's your fight flight, your drive. It's your get up and went in the morning. I want to do something. I got interest in. And if you shut that down, guess what? You become like, zombie-like. You don't care anymore. You don't want to do much anymore. You may not feel quite as bad, but you don't feel like doing anything else either. We're using cannabinoids, a little bit of THC, marijuana, back in the day. They're using those pieces as well. And our old friend today that we know that we have more problems with is gabapentin, the addictive drugs. And, it was really funny. You look at a patient and they go to a doctor for surgery. They go to a doctor for pain pattern. They go to a doctor for something that is untenable in their life. And these docs immediately write across the board, for the most part, not 100%, a prescription for gabapentin. Very addictive, by the way. And also something called, if I can pronounce it, it's called pregabalin. It's a cousin as well. And they give you multiple refills. And those things together, as I said earlier, only drop the pain, not 100%, not necessarily 50%. They're saying in many cases, 30, maybe 35, 40%, but most of them, no, the pain pattern's still there. So you get hooked on more and more. There's other drugs out there like tramadol, and it makes me crazy, as those of you know me, when I start thinking, when there's other ways of handling this, and you're looking at these types of addictive medications, there seems to be a crime there someplace. And it's up to us to realize that we have to shift. But we'll get into all of that. We'll talk about, why these medications really don't work and what you can do to make a difference with it. But you have to understand what it really is. And, when you get into the different articles that have been written over a period of time, one going back even, probably about 16, 17 years ago, and you follow it through with the same authors, they're going to tell you that this fibromyalgia complex, this presentation, is not only poorly understood, but the treatments are incredibly disappointing because nothing seems to work. Why? Because they're not looking in the right place. They don't understand it. Most fibromyalgic pain comes from a disruption in the neurological transmission of the central nervous system, the brain, the spinal cord, out the periphery to the targets. Now, if that's the case, wouldn't it be interesting to find out in my world what we're talking about of spinal disrelationships, whether it starts with the 22 bones of the skull, and there may have been an injury way back in the day, or a disrelationship of the positioning of the vertebrae of the spine. We call it a spinal subluxation. The osteopaths call it a spinal lesion, but the effect is the same thing. It stops the transmission of the neurological signaling in the pathway that it should be normalized in, right? So you get upregulation or you get downregulation. So too much or too little. So we want to make sure that we understand what it really is. And if we get it, now, I want to go to one thing before we're getting close to the end of the program. And I want you to understand that there's symptoms that go with it. It's drowsiness and sleepiness and lack of focus and weight gain, because your cortisol levels begin to get skewed like crazy. And we're going to talk about that over the next several weeks. But I want you to know we've been treating this for decades, and we're doing an extremely good job. And I promise you, we're getting better results than what they're doing with drugs. Having said that, make sure you stay tuned and you listen to the live stream coming up. And just go to drtomroselle.com. Don't forget to follow me on all social media sites, and it will let you know when we're going to do things. But this is a program that you're going to gain so much about. Put the date away, June 12th, 6 p.m., Roselle Center for Healing. I'll see you in a couple seconds on Ageless Health live stream. Make sure you follow me. Remember, I do this every Sunday for one reason only. I love you all. Have a great day. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Fibromyalgia on Wednesday, June 12th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.